The FDA recall into cantaloupe has expanded. U.S. health officials recalled 3 more brands of whole and pre-cut cantaloupes after more people across the country have gotten ill, including right here in Wisconsin. Joining us to talk about that and our other health headlines, Dr. Jeff Pothof, UW Health's Chief Quality Officer. Doc, great to see you. I love cantaloupe. I do not love the kind that will get me sick. What's the concern here?
No, so the concern here is salmonella. It's actually a bacteria, and it can make you pretty sick. You'll get nausea, stomach cramps, diarrhea. More severe cases, you can get more sick and even have bloody diarrhea. It's contaminated the outside of these cantaloupes. So if you have any of these cantaloupe in your kitchen or in your pantry, you want to remove them. But removing them isn't enough. You actually want to wash those surfaces with some soap and water, just because that salmonella can live on those surfaces for a while. You might not be completely out of the woods just by throwing it in the garbage.
Yeah, the warning kind of reads like raw meat, like throwing the fruit out's not good enough. Is that all we need, though? What kills salmonella? Just the soap and water? Is that good enough for cleaning our kitchens?
You know, soap and water is just fine. If you want to get fancy, you can use Lysol, diluted bleach solutions. You don't have to get too crazy with it, but just do something to make sure you've disinfected that surface after you've thrown those cantaloupe away.
If you were like me, you ate like a pig during Thanksgiving, and now it's time to burn off all that extra weight. Interesting new research, how we can get out of exercising during the week. I'm all for this kind of research, doctor. What did it find?
I mean, this has got to be good news. So, I think historically what we've said as physicians, some activity is better than none. And if you really want to hit the mark, you want to exercise about 30 minutes, 5 days a week. Well, life kind of gets in the way with the 5 days a week thing. Everyone's busy. We've got kids to take to soccer. How are we supposed to do that during the week? This study says, well, what if you take the weekends and you get 150 minutes of exercise during the weekend? So you kind of load all your exercise onto the weekend. Is that just as good? Answer is maybe so. So I think the take home is there's flexibility. You want to get about 150 minutes of exercise per week. If you can do that during the week, great. If you need to wait till the weekend, just fine. It's more about getting those minutes in than how you go about getting them.
Now, the key is, how do you get 2.5 hours to work out during the weekend? And I think I'd pass out if I worked out for 2.5 hours. Is that kind of the mark? You kind of have to replace all of the exercise you were doing during the week and cramming it into the weekend?
Well, I think you can, but I think, the more realistic thing is, there's probably a couple of days a week where you can get, 30 minutes, 45 minutes of exercise in, but probably not all 5 days. And then maybe you hit it a little bit harder on the weekend. You do an hour on Saturday, an hour on Sunday, something like that. But I think having that flexibility feels a whole lot better than having to find 30 minutes every day or doing it all on the weekend.
And if we needed one more reason to work out, there's new research that says belly fat actually bad for our brain.
Maybe. This is a small study, a little over 50 people, but what they did is they correlated visceral fat. Now, this is not the fat that you can squeeze. It's not your love handles. This is fat that surrounds our internal organs. The people who had a higher percentage or higher amount of visceral fat also had more amyloid in their brain, which is a precursor to Alzheimer's disease. We don't know exactly what this means yet, but with Alzheimer's disease, we're trying to find things that we can impact earlier in life, 40s and 50s, to keep us from developing Alzheimer's later in life. This might be one of those things where we watch more closely our visceral fat.
All my focus has been on the turkey that's still in my fridge, and now I got to start focusing on that treadmill. Dr. Jeff Pothof, appreciate your time.
Thank you. Have a good day.